Hi guys, this is Amrit and I'd like to welcome you to Ask ProEd. This video is for educational purposes only, and please never practice medical skills without the proper credentials. Today I'm going to share with you a very important topic which is on medication history taking, or how to take a best possible medication history interview. So obviously start the station by washing your hands and introducing yourself. So for example, hi, my name's Amrit. I'm one of the junior medical doctors who will be looking after you today. Can I please confirm your full name and date of birth? Thank you. Okay. Amanda, it's lovely to meet you. I'd like to ask you some questions about your medications. Is that okay? Fantastic. So make sure that you provide a clear introduction to the interview. Make sure that you determine the individual responsible for the administration and management of the medications. If this is the patient themselves, then they're able to communicate and you can go ahead with them. If it's the carer or somebody else like a parent who manages the medications, then the interview needs to happen with the carer or the parent with obvious consents and legalities checked off. Ask about previous adverse medication events or allergies. Confirming an allergy or adverse medication event often requires more than one question, as often patients do not understand what an adverse event is. For example, you might ask, are there any medications that you're allergic to, or have you had a bad reaction to a medication? It is important to document an accurate and comprehensive allergy and adverse medication event history, confirming the details of any medication allergies or adverse reactions with the patient or the carer, and documenting the details of the drug, the reaction, and the date of the reaction if this is a known reaction on a certain date, and documenting this on the patient's medication chart as well as the patient's medical record. So I can ask, Amanda, do you have any drug allergies? What happens when you take this medication? When did you last take it? And what was the reaction? Sometimes patients don't know what the reaction was, so it could be an unknown reaction, and you can write unknown next to the medication name. In the AMC clinical stations, you're always given paper and pen, and if you ever get such a station, then please make sure that you write on this piece of paper the medication name and the allergy type, as well as when this last reaction happened, like the date. And then as the interview goes on, you can start to document the regular medications. Don't forget to write, like, next to the medication, the name, the medication route, and the dose of the drug and frequency. In a clinical station, please show that you have structure, and clarify, and make sure that you show that you've got structure. So for example, Amanda, what is the medication, or what do you call the medication that you take? What is the medication for? So what I'm trying to ask is, what was the indication of the medication? Include information about the brand, the strength, the form, the route, the dose, and the frequency, and of course, the duration of the therapy and its indication. For example, why is the patient taking the medication? Or why does the patient think that they're taking the medication? Remember to ask specifically about prescriptions and non-prescription medication, as well as complementary medications. Many drugs have multiple indications, and the most common indication may not be the reason the patient is taking the medication. Indications continually change with time and the results of the new research that's becoming available. So, for example, the patient tells you that I'm taking a medication called lamotrigine. So this medication falls under anti-epileptic drugs. So naturally, you assume that the patient is taking it for epilepsy, but that is not always correct. Lamotrigine is also used for bipolar disorder as a prevention for depressive episodes. So make sure that you always confirm as to why they're taking the medication. Question. So please ask, what is the medication for? Another question. What strength or tablets are you taking? How much of it are you taking? Or how many tablets are you taking? Over here, keep in mind that the terms of milligrams or micrograms, and sometimes they may say in terms of like tablets or capsules or puffs or injection, etc. So document the information that you have been given very correctly. And another common mistake that people make is, for example, MCG versus MG. So let's say the medication that's commonly used for hypothyroidism may come in the form of MCG, so levothyroxine 50 mcg, but somebody while writing may write 50 mg, so that's wrong. So please make sure that you're documenting correct information. The next question to ask is, how often do you take your medication? Is it once a day, twice a day, thrice a day, or 4 times a day, or something else? When did you start this medication, or for how long have you been taking this medication? Knowing how long the patient has been taking a medication is important, as this tells us the likelihood of risks such as development of gastric ulcers with NSAIDs and or long-term side effects with a particular drug. The next question is, how do you take this medication? So on a typical day, how would you take this one? Is it with food or an empty stomach? So make sure you ask that. The next question is, do you also take other types of medications like eye drops or ear drops or creams or sprays or patches or vitamins or any naturopathic medication or over-the-counter medication? Do you take any over-the-counter medication? So this is a very commonly missed question. Please make sure that you ask that, because you will be surprised how many OTC medications a person can take and not disclose in a regular medications history. Many of these products contain pharmacologically active ingredients that can cause or exacerbate medical conditions. So please always ask. Medications can provide important collateral information about a patient's medical history. The patient may not mention that they have depression or anxiety or chronic pain in their medical history, but if they're taking a medication indicated for these conditions, this may provide a clue which you can explore further. In my day-to-day practice, it happens often that I ask patients, do you have any other medical problems? And they say no. And when I ask about the medication history, they say, oh yeah, I'm on fluoxetine, I'm on quetiapine, I'm on diazepam. And then I'm like, okay, and why are you taking this? So you see, medications do provide important information. So please make sure you ask. Another important question is, assessing, or I would not say question, but another important thing to do is assessing a patient's understanding, attitude, and adherence. So ask questions which can kind of, indirectly assess their adherence. So people often have difficulties taking their medication. So for one reason or another, you can ask like, have you had any difficulties taking your medication? Or you can ask, how often would you say you miss taking your medication? So we're seeking information on the patient's understanding of the rationale of their treatment, perception for the purpose of the medication and its effectiveness, perception of potential adverse effects, understanding of monitoring of disease or medicine. Next, I would ask social history. So, Amanda, I'm going to ask you some questions about your lifestyle now. Is that all right? Fantastic. How are you managing your medications? Do you have support at home? Do you have help with your medications at home? Do you smoke? If so, how much? And since how long have you been a smoker? And please make sure that you document the smoking part. Next is, do you drink alcohol? Ask the frequency, the type of alcohol, the amount of alcohol consumed on a weekly basis, and as well document that. Do you use any recreational drugs? Which drugs do you use and how frequently? Document that as well. You can ask about diet and exercise, like, are you physically active? What is your diet like on an average day? And finally, we ask about occupational history. Some jobs involving the operation of heavy machinery or driving may restrict the types of medication that a person is able to take. Or if they want to continue these tasks or jobs, they need to not be on certain drugs. So ask, like, are you working? What's your work like? Alrighty, guys, that's all for the best possible medication history interview. I hope this was useful information for you. I wish you all the very best in your exam preparation. Please don't forget to hit the like and the subscribe icon. And until next time, take care of yourself. Thank you.